years ago I would never have had the courage to stand and say that I'm a survivor of sexual abuse. I can do that quite easily now because I can see the difference it's made to my life. And I think we imagine people who've suffered such sometimes horrific childhoods become hopeless adults. We don't. We are so useful in terms of education. And one of the things I always knew was that if only people understood when they say that, when they do that, or when they don't do something. I know they're not bad people, but they don't know what they don't know. So I made it a kind of commitment to myself that I would share my story, but also other women's stories if they wished, so that education could be furthered, so that materials could be developed, and so that women coming into maternity care would feel safe, would feel enabled, and would become the mothers they want to be. And that's really what we can do. And we can go from a bad memory of our lives into a fantastic photograph of a birth that gives us good memories and gives us a sense of self-respect and belief. This is really great for me to be able to present this subject matter to an interested audience. Some of you might know that I'm a consultant midwife. I'm based in Birmingham at City Hospital. However, for many, many years, this subject matter has been very dear to me. I have had a growing interest in caring for women. Being a survivor of sexual abuse myself, I learnt from a very painful experience of giving birth that this can be a difficult time for women. And also I came to realise difficult time for clinicians who have very little idea, very little training on how to help, how to recognise and how to deal with these situations when they present themselves. So what I'm going to talk to you about is, I guess, a lifetime's work, but in half an hour. So I'll do my very best to give you information and some advice on how to address some of these very difficult issues. So first of all, what I want to draw your attention to is the prevalence. And I've got some very kind of academic sources on the screen at the moment, but what we know is that the abuse of women is common. Girls are much more likely to be sexually abused than boys, and what we have discovered over time, it's usually someone who's well known to the family or actually within the family. And we also know from studies that have been done on survivors that it occurs on more than one occasion. So if you look at the statistics, you may think that the references might be old, but actually they are very concurrent in terms of what we're finding out. And we know that about 1 in 4 women, when they reach adulthood, has had an experience of sexual abuse. What you can also see is a comparison between female and male non-contact and contact abuse, and you can see the difference there. And actually there are studies looking at high-income countries and also low-income, and there are differences based on those kind of demographies, but still females are the most prevalent of the survivors of abuse. If you also look at some of the international kind of reports on sexual abuse and violence against women, it states particularly in a very, I would highly recommend this report, is the World Health Report on violence against females. And they acknowledge that it's very common, about 1/5 of all women are experiencing some kind of violence, including sexual violence. And they also report that it's more prevalent in some populations, such as substance abusers, women who find themselves homeless, and actually a very definitive group of women who are psychiatric inpatients. In fact, in the UK, a dear friend of mine who actually has died now but used to be a consultant nurse for gender equality, introduced a system whereby every woman admitted to psychiatric services would have the opportunity to discuss and divulge her experiences of sexual abuse. Now, more specific to our work is that over half the babies born to girls around 18 years old and younger are fathered by men at least 20 years old, and the majority at least over 10 years older than the female. So I think that's an important element we need to bear in mind. So just to recap a little bit, in survivor studies, it's claimed that 97% of women have known their abuser. Most female children are sexually abused by someone in their family. The most common perpetrators of rape are husbands and partners to women. We know if rape, abuse and sexual assault occur and it's an unknown to the woman or a contact just made, then she's much more likely to disclose that abuse, and she's much more likely to continue to court and achieve a conviction if it's a stranger. We also know if the victim's not disclosed within 1 month, then they are less likely to. And if they're abused by a family member, first-line relative, they are much less likely to disclose their abuse. So just to give you, for the UK, particularly in terms of our law, sexual abuse is defined as forcing or enticing a child or young person to take part in sexual activities. And this is whether or not the child is aware of what's happening. So that's quite important. There is no way a child of 5 years old can give consent or can understand in detail what's happening to them. And if you refer to the Home Office Sexual Offences Act 2003, the definition was altered at that time of the White Paper to be very succinct. So rape is now classified as penetration by the penis of someone's vagina, anus or mouth without their consent. Rape can be committed against men or women, but since it involves penile penetration, it's only an offence and committed by men. And this law covers any kind of intentional sexual touching of someone else without their consent, and it can include touching any part of their body which is clothed or unclothed at the time of the abuse, either with parts of the body or with an object. Now that really opened up the issues around taking cases to court, because if you may not know this, but if before there had not been body-to-body contact and there was an object used, then it was much more difficult to achieve conviction. So let's look at disclosure rates. Smith wrote a paper in 2000, and this is work for the Survivors Trust. They have a fantastic website that brings together all of the survivor voluntary organisations. What they found in their survey was 27% of women disclosed childhood rape within the first month of its occurrence. 34% disclosed a little bit later, that was within 6 months. 18% of those survivors could not remember if they had disclosed, and 47% delayed or failed to disclose. So as you can see from that, a significant number never report their abuse. What the Survivor Trust also found was when disclosing to professionals, particularly clinicians, our behaviour can be one of the ways that makes a survivor feel like they can or cannot disclose to us. Because what we, in the survey, what we said we felt was disbelief, we were angry, we denied that it could have happened. Some of us were outraged. Some of us were very uncertain what to do next. But the majority stated they had a lack of training, lack of understanding about what to do. So what we can look at in terms of disclosure is that it's accidental or deliberate, particularly in the case of children. So that may mean that children spill it out as a just normal part of their conversation. However, it can result from suspicion of others around them. There can be a medical interaction and a query made, and then disclosure happens. There can be photographic or video evidence that the police have obtained, and they have found evidence of a child being used in that way. What we do know from the research is that children and adults, when they disclose, often minimise what's happened. So they will tell you enough, but not everything. Some withhold information, and there are factors such as age, culture, ethnicity, faith, physical or mental disabilities that affect someone's ability to disclose. So it's a very social but also critical element of how people can tell their stories. So a little bit to tell you how it happens. Well, from studies that have been done across the inmate populations in sexual offenders institutions, and there are several in the UK, and they hold some of them up to 3,000 to 6,000 convicts. What we know from those studies is they spot vulnerabilities in the child or the mother. Some may marry into a family where the child is or children are. They isolate the child and make them feel particularly special, then use a series of behaviours such as threats, coercion, bribes, and over time instill a sense of hopelessness within the child. They create the sexual event and then trap the child and tell them after the usual time of where incitement such as bribery is not working, that something bad is going to happen to them and someone close or trusted might be hurt because of them. And the other methods that are used, particularly as children get older, are drugs, alcohol, and other illegal substances. But what's important for you to know is many paedophiles will spend years and years grooming children and move from one to the other, so there's a steady supply. Some of the things they say about why they do it are that women and children enjoy it, that women and children say no but mean yes, that the behaviour of young children and women invoke it or provoke it by their dress, that actually men have got this uncontrollable sex drive, so they're unable to do anything about it at all. Some of them promote that it's educative and it teaches the victim about sex. One of the myths that I think is very, very dangerous is that it's a stranger, and you can already know that that's not true. They say that it doesn't harm children and it has no lasting effects. So this is the belief system that paedophiles generally buy into. But we know, and we know from many different health studies, that child sexual abuse influences the way women live their life. It forms problems with relationships. They find it difficult to deal with adversity, to cope with just the everyday problems and relationships with their own children and the people around them. It can prevent them from being healthy and living their life to the full. So some of the effects, just to drill down into this on an individual, is from a psychological and behavioural point of view, that who you believe you are and could be is altered. That very often the survivor will see themselves as a thing, not part of who they are. They take risks in life, and this means doing drugs or taking risks in their health that they might not ordinarily do. They build defense mechanisms around them to stop people asking questions and getting close to them. There's an uncertainty around the personal boundaries that are set around survivors, and generally live in a pattern of denial and dissociation. And there are obviously psychological and psychiatric sequelae to women who have had depression, trauma symptoms, suicide attempts, and other forms of harm. And actually there are strong studies to state that the programming of the brain, the neurochemicals within the brain, is altered, and this is really borne out in some of the more interesting studies. On a physical level, we now know that the psychological elements of life can affect our physical life dramatically. And so women may suffer from gastrointestinal disorders, including eating problems, may chain smoke, may have multiple stress and anxiety disorders, sleep problems, musculoskeletal problems, migraines, and even epilepsy. So it has massive implications for life. I have a few slides that do demonstrate the effect of prolonged and enduring stress, because anyone knows that when you're worried or when you are feeling stress, that you stimulate and produce a lot of unhealthy continuing hormones that affect the systems in the body. And some of these go on much later into life. So that as a young person moving into adulthood, there's lots of behaviours that can be really detrimental to both work, life and relationships. So such things as eating disorders and self-injuries and phobias, needing to be in control all the time, feeling suicidal, feeling angry, feeling depressed, not having control over your life, having a victim persona, not having healthy relationships based on equality, and not understanding around safety skills that protect you from vulnerable situations. So just run through a few of the longer term issues which are affecting, as we know, some of the major organs, and obesity particularly can be an issue for life. So can being underweight, and so can having a suppressed immune system that leads to all sorts of sequelae. So when you've been in a situation where you are with a trusted adult, you may feel that what is happening in front of you is absolutely astronomical. It's hard to believe. You cannot work out why this is happening to you. So neurologically, the hypothalamus, which is your fight or flight organ, starts to pump out all the adrenaline and make it ready for you to run away, but you can't. So the next process that happens is you dissociate. So there's an element within that limbic system that is protective, so that if you see this extraordinary event in front of you, then you're having a mechanism to enable you to deal with it. What then happens is this becomes a reroute of the normal processes in the brain, to the point with some survivors where they develop something called psychogenic amnesia. This means that the stress changes in the brain and it alters the cognitive responses. So let's look at the effect on reproductivity. You can only guess how this might affect a woman. As we have surveyed women, we found that they're more likely to suffer from sexually acquired infections, dyspareunia and vaginismus. Endometriosis is a common factor among sexual abuse survivors. Unremitting pelvic pain, that the woman has had so many investigations but still no answer to her problem. Women who request permanent sterilisation and hysterectomy. And then, of course, we've got the presentations in pregnancy of a very young pregnant teenager. A woman, for no common reason, would ask for her baby to be adopted. Rigid patterns and birth plans for labour. Women who are susceptible to birth trauma. Women whose control is such that whatever the risk to her, she'll request a home birth, or she'll actually request an operative delivery so that she doesn't have to participate. And of course then there are issues around reluctance to breastfeed and how she attaches to her baby. So this is just a paper that might be useful for those of you who are interested in pelvic pain. Lots of work has been done on this, and actually this paper really draws attention to the fact that the majority of unremitting pelvic pain, which is as common as back pain or migraine, has its roots in childhood sexual abuse. So, looking at the sequelae and what that means for us as health providers, it's a blind spot in health. Incest is a word we rarely hear and use, and from the work that's been done on some of the more well-known psychoanalysts and psychotherapists, what they have found is that there's an inexcusable lack of training, that the individual will feel overwhelmed when they're faced with the problem, that we've got a poor understanding and fit of what violence-related problems are within the clinical medical model of care. There's a fear of us being exposed as not knowledgeable enough, and some of us identify because we are those victims as well. So all of you who work in maternity will know that maternity is under pressure to deliver care that actually is system processed. And women tell us that they are vulnerable during this time, that they note that there is a hierarchy, a sense of domination, that the boundaries are blurred because women are told that they will have certain procedures, but consent is assumed rather than given. The other thing to state is that where technology has replaced people, women dissociate even further, and this can be difficult for them. So what the perinatal period means for survivors is that they are submitted to multiple intrusive examinations. They are expected to be unclothed, they are expected to lie down, they are expecting that you as the caregiver are upright, and they are in our territory, not theirs. What you need to understand is the survivor might behave just like she did with the abuser. She might panic, she might be unable to speak, she may be tense, she may cry, and she may dissociate. So what can you do? Well, these are some of the critical moments in childbirth. Any examination where you are touching that woman is critical. Now, look, during an ultrasound scan, women are particularly vulnerable. They're in the dark. Someone is using an object on their abdomen. Someone is putting something wet on their abdomen. And someone is using a TV screen to tell them what's inside of them. Blood taking can be a particular issue, and we know from the studies that many survivors have phobias about needles and blood. So that's an area to be mindful. The questioning, we come straight in as midwives particularly and ask extremely sensitive and sensual questions. So there is no premise into that, we go straight into it. Women who are on the bed feel almost as if they're unable to move. Of course, vaginal examinations are a time where no woman is looking forward to, but there are different connotations when you have survived abuse. Pain, intimate procedures, and when things go wrong are all areas that we should be mindful of. So these are the situations that will reactivate the past for the survivor. She can then have from a range of trauma symptoms and psychiatric illnesses that have a real almost like fall into the abyss in terms of their mental well-being. So some of the questions that survivors particularly have told me that have bothered them have been, when did you have sex? When did you have intercourse? When was your last period? And the reason these can be so trigger susceptible is their abuser may well have asked these questions. Who's the baby's father? If you are a 14-year-old pregnant teenager and your abuser is with you, it's very difficult for them to be able to disclose that. Questions about sexually transmitted diseases, have you had a mental illness, and have you felt your baby move? I'll come back to that in a second. So going back to some of those things, this is what the survivor groups have told me, that taking blood pressure particularly, information from women, pictures about and from them, measurements, consent, and taking the baby out are trigger moments. And these are some of the cognitive triggers that survivors have listed. So the intimate questions, which we've just gone through, they experience and store memories from the past in their body. So when we are touching their body, they may behave in a way that was just the same as they did with their abuser. So this may trigger in us a different response. Some of them have sensitivity to smell, noises, and the environment. One midwife asked me why it was important for a woman to have a window in the room when she was labouring. She needed the outside world to be available to her at all times, and four walls around her made her feel as if she was in a prison. And one of the major issues for these women is, over years they've built up control to be able to live their lives, and all of a sudden they're losing that control. So some of the theoretical elements that have looked at these have said that there are 4 distinct styles in labour where survivors behave. They are fighting, so they're fighting against you. They're taking control and preventing you from getting near to them. They surrender and become passive, or they retreat into another world and you can't reach them. What I've got is now some quotes from survivors that might help you understand some of the things that they're trying to say. What psychotherapists say is women talk in metaphors, particularly when they've been abused and they start to disclose. This quote from this poem will tell you, "The child in me is hurting. She feels such pain inside, of years of passive torture she lived through in denial. She played a game of make-believe. She fooled the best of them. But now pretense is over. She hurts so much again." So those triggers are very easily responded to by some of the things that happen during pregnancy and labour. So when you have a woman in her antenatal period, there are some real useful things that might give you an idea of how you are going to have to provide care for this woman. Does she seem afraid of those intimate questions? Is she reluctant to attend the clinic? Is she requesting straight away a caesarean section? Does she present week after week with increased minor ailments with no remit? Is her pregnancy a result of sexual abuse but she's not able to tell you? Is she behaving very aggressively or passively? And does she present that she doesn't like you touching her? This quote, "I hated the antenatal clinic when the cuff went round my arm to take my blood pressure. It was just as if he was pinning me down to the floor again, trapped. Every part of my body belonged to them, nowhere for me to hide anymore. I was trapped into being a good girl again. My pregnancy was a shock. I didn't believe it was clean enough for a pure fetus, and I bled throughout pregnancy. I thought the fetus was trying to escape the confines of my dirty insides." So in labour, how can you identify these women? Well, labour we know is a primal event. It happens whether the woman's ready for it or not. There's a loss of control. There's a loss of body fluids, and some women find this terribly disorganising in terms of their mental health. Their loss of mobility together with that shows and confirms that they're not in control. The intensity of the pain is quite difficult for some of them. The blood loss reminds them of the first time or when they were raped. The crowning head, that burning sensation as the crowning part reaches the perineum, and the continuing insertion of fingers or instruments. And then afterwards, the sore perineum, and how do I cope? So some of the things in labour that we commonly do, and we're much better at this now, but some of us slip into old habits, such as using words of encouragement as darling, sweetheart, pet. I'm just going to put this inside of you, and just lubricating my fingers first. Lift your bottom up. Here's a tissue to wipe yourself. Come on, push harder, and put your nipple in his mouth. So a quote again. "The labour ward was dimly lit. I could hear other women moaning in the throes of labour. My muffled cries of pain were swallowed before they disturbed the other women. I was a child in the night again, knowing that somewhere in the dark lay the fear of my life, my father." So even at the most critical time, labour didn't protect them from the abuse. And then my baby had been torn from my insides. I'd been multiply humiliated, and no one seemed to notice the hollow woman lying on a bloody hospital sheet with empty eyes. I looked down and saw a stranger in the birth room holding a baby. It was me. I didn't recover easily from that experience. I spiraled downward into the first of my major depressive episodes. I was never diagnosed with postnatal depression, but I knew I had both severely. So some of the quotes, just to bring you an overview, is women can hate the way the baby moves. It feels alienated from them. They don't like the way it makes their body feel. They don't know who they are anymore. Couldn't even think about what was happening to them. Blanking the pregnancy completely out of their mind until the point of giving birth home alone in the bedroom. and just handing over control to the health providers and saying, do what you want. It's not my body anyway. And things that we say and we hear said, think of your baby. You don't want your baby to die. But this survivor says, what about me? I died inside a long time ago. So becoming a parent is a huge leap of faith, and these women have choices to make that other women don't. They may be thinking about, can I keep this baby? Will it be safe? My abuser's near to me. I may become paranoid and overwhelmed with the responsibility, and the baby's cry trigger me to becoming much more of a vulnerable mother than I might have been. And also remember that the gender of the baby can be an issue for some women. So she might say to you, I'm anxious about my health, and just as she did in pregnancy, attend frequently at the GP surgery or your postnatal surgeries. She might be afraid of her blood loss. She might be afraid of her baby being touched or removed. Don't assume that breastfeeding is not going to be an issue. Some women want to breastfeed, but they find the whole issue of it is so difficult that they can't do it. This quote says, she grabbed my breast. She was obviously busy and wanted to get on with what she had to do, and I only wanted to see if my baby was attached to my breast properly. She pulled my sore breast and then held my baby by her head and pushed her onto me. I lost track. I was gone. I wasn't feeding my beautiful baby. I was on the carpet, 12 years old. He was towering over me, touching my chest in exactly the same way. So, as I draw to the end of this webinar, I just want to give you a quote from my memories and personal diaries. I used to call myself the woman of dirt. And this is just a couple of lines from a poem that I wrote. My body's the evidence, the spoils of his crime. It's tainted and dirty, never to be mine. I cringe and I shudder, the memories still hurt of the baby, the child, the woman of dirt. So just remember that most women will not tell you directly. They know you can't change what has happened to them, but they're testing the water, and if they trust you, they might let you in to know a little bit about their past story. They probably want you to ask them, and they probably want you to help them. So the best thing you can do is be aware of the triggers, ask her what it feels like, and ask her to tell you what it feels like when she's feeling out of control. Make sure that environment is safe and not interrupted, and keep your voice in a gentle but a defined tone. If there's a procedure, just make sure that you use her name that she's given to you, not what you assume. Tell her everything about her body. Ask her what she wants and what she doesn't want, and don't do anything to surprise her. Be adaptable. If you want to feel her abdomen, do it over a t-shirt. There's many ways of doing clinical procedures. Touch can be quite intrusive, and one of the ways that I found to help in having my blood pressure taken is to put the cuff on myself. My GP was aware that he couldn't do it, so he would hand to me the squeezy bit, I would pump it up, and he would listen. Very, very simple. So it's about being calm, thinking out the box, and finding ways to do different things. So remember, language is a powerful tool, and we should be thinking all the time about how we use it. It's her life, she'll move forward, but she will be very thankful of what you've done if you've made it easier for her. She alone has consent, we don't. For some women, birth can be very healing and be the moment in which they can shed all the past. We need to be much better educated and aware, And we need to develop listening and observational skills, not just using clinical techniques. Find out what's okay and what's not. Don't assume anything, and seek help, supervision, and protect yourself. So to finish, a survivor told us, you can't take away the pain of my past, but you can help by just doing a few small things. Call me by my name. Look at me when you speak to me. Don't touch me from without my permission. Don't come up to me from behind you. Don't say, that's a good girl. Don't hold a mask over my face. Don't whisper or shout, but reassure me constantly. And if you do some of these things, I'll feel safer, not so vulnerable, and I'll be able to cope with my baby and my life. So I'd like to finish to say that we have amazing power and abilities and opportunities to make childbirth an event that's memorable, one that does women great good and no harm. And I don't know about you, but I don't know women that are going to come through our system. We don't ask them those questions, whether they're a survivor or not. So the easiest thing to do is to have a universal approach and expect that everyone is a survivor. Thank you very much.